Hey guys, I'm back. Sorry, that video took forever to process, and then the baby woke up and spit up everywhere, and then I took a shower, and it's ridiculous. Anyways, back where I left off. Okay, I think I answered all the questions. And now I'm just gonna tell you a bit, like, if you're interested in surrogacy, where to go, what to do, at least what I've done. Jeez, I'm sorry. I think there's something in this room that I'm allergic to. Every time I come back here, I sneeze. Anyways. Oh my gosh. Okay, let's try again. So the first thing I would do is definitely research it. I can't stress enough how much to research it, because you're not just changing your life, you're potentially changing somebody else's life. And you don't want to be halfway through the pregnancy and decide you can't do it, you know? You don't want to be going in for the IVF transfer and then not be able to do it, you know, like tell them, oh, sorry, I'm all the way here at the fertility clinic, but I can't show up. So definitely research it. The second thing is decide whether you want to kind of go at it by yourself or you want to be represented by an agency. Obviously I don't have a ton of experience, but what I have seen online, agencies, you make a little bit less, still nowhere in a horrible amount, but you make a little bit less, but they do save you a lot of time, I would imagine. You know, you're not answering ads, you're not making ads, they're doing all that for you, and they email you and they're like, hey, we have a couple, and you say okay, and then, you know, it goes from there. So decide that, and then if you do decide to do an agency, I found all the agencies that I had applied for in a Google search. I just typed in surrogacy agency and just went through and filled them out. They have extremely long questionnaires. They're very personal, so if you don't feel comfortable with telling your intended parents, like, pretty much everything about you, you know, probably not a good idea to do it. They ask you all of your history, like if you've ever done drugs, if you've ever drank, if you've had psychiatric care, if you've gone to therapy for some reason. I mean, it gets pretty personal. And then there's also things you have to be okay with after you are pregnant. So, well, and then I guess the process of being pregnant. IVF is, from what I understand, a very long process. It's kind of a pain, and I'll tell you a bit about that in just a second. And so you have to be prepared to do that. You also have to be prepared to go to travel. Usually, very doubtfully, will their fertility clinic be in the same area you're in. So you have to go to their fertility clinic once, maybe twice, depending. You have to really think about if you would reduce for a multiple pregnancy, what you would consider allowing them to abort for, or if you wouldn't at all. There's a ton of stuff to consider, and even though I had researched, I still didn't realize that until I started filling out the surrogacy applications, and they were asking me questions I had never thought of. I never thought about what happens if I have 8 babies, like, will I reduce them down to twins, or, you know, what? You have to decide how many babies you're comfortable with carrying. I told them I would carry no more than twins, preferably. Maybe, very slight chance I would carry triplets, but probably just twins. So you have to decide that. So, yeah, and then after you've decided that, if you do decide to go the on your own route or whatever, there's a couple classified boards online. You can search surrogacy classifieds in Google. The two I used and that I really liked were Surro, S-U-R-R-O, momsonline.com, and the other one was allaboutsurrogacy.com, and they both have classified sections in there, and you can go and respond to ads and also post your own. You have to decide whether you want to be a gestational or a traditional surrogate. A traditional surrogate, you will donate your egg. There's also people that ask for at-home inseminations there, so you have to be maybe okay with that. Gestational surrogate, you are just a rent-a-womb. There's no genetic link to the child that you're carrying, and that was what I chose to do. I didn't feel like I could give up a child that was part mine, even if it was just my egg. I would just feel like it was mine. So I had to do gestational. Some agents will ask you if you would prefer to do frozen embryos or fresh embryo transfers. There's a little bit of a difference. Frozen embryos, they line up your cycle, they unfreeze the embryos, they implant them, ta-da. Fresh embryos, if you, for example, are using a egg from the mother, you both have to go through a month or two of medication to align your cycles, and then they'll take the egg from her, fertilize it, and then put it in you. So you just have to really decide all that, and it is sort of hard to decide. I will be doing, if I get the couple that I'm talking to right now, I'll be doing a frozen embryo transfer, so it's a little bit easier, I would imagine. But there's also a less chance of survival with frozen because the embryos are damaged. Sometimes, not always. The embryos can get damaged in the unthawing process. So, as far as the IVF process, just to give you like a little bit, I'm not going to read everything, but to give you like a little bit of what you're going to have to do is okay, the embryo transfer. Oh, this isn't the site I was looking for. But basically, okay, just a little bit about the embryo transfer though. No anesthesia is necessary for the procedure. The woman lies on her back or in the knee-chest position using a vaginal speculum. The doctor exposes the cervix. One or more embryos suspended in a drop of culture medium are drawn into a transfer catheter. A long, thin, sterile tube with a syringe on one end. Gently, the physician guides the tip of the loaded catheter through the cervix and deposits the fluid containing the embryos into the uterine cavity. One or more embryos may be transferred during this procedure. The entire transfer procedure usually takes between 10 to 20 minutes. Before that, though, I'm not finding the site that I had found at one point. There is a ton of things you have to do before you even get to the embryo transfer stage. Okay, so the surrogate mother is seen several times during the treatment cycle for the purpose of monitoring her endometrium, which is the lining of the uterus. Prior to the embryo transfer, she takes several medications that prepare the endometrium to receive the embryos. The physician will determine when she must begin the daily progesterone injections, and she is to continue them until ordered to stop by the physician. Okay, so basically they're trying to convince your body that it's pregnant. So you will be taking anywhere from 1 to 3 different medications a day. Sometimes doctors will give you in pill or patch form. Most doctors will give it to you in an injection form. So either you or your partner will have to inject the medication into your butt. So be prepared for that. The embryo transfer is performed with the surrogate mother in a gynecological position and requires no anesthesia. After the proper cleansing procedures, a tiny plastic catheter is introduced into the uterus. That's what I just told you from that other site. When the surrogate mother is released after the embryo transfer, she will be taken to she'll be taken either home or to a hotel for bed rest, and she's only allowed to get up to go to the bathroom. The regimen is continued for 2 more days. After this time, the surrogate mother may resume her normal activities with the limitations provided to her by the physician at the time of the embryo transfer. Some of the limitations are, and this is again the stuff you have to think about, like if you're willing to do this: complete pelvic rest, no douching or sexual intercourse, showers only, no tub baths, no strenuous activities such as exercising, running, heavy lifting, including children, groceries, and luggage. A pregnancy test will be performed 2 weeks following the embryo transfer. If a pregnancy occurs, the surrogate mother will have several visits to the clinic to monitor the hormone level and the progress of the embryos. The monitoring is done by blood tests and ultrasounds. If a pregnancy does not occur, the surrogate physician will instruct the mother when to stop the medications and when to expect her next period, and then they can decide from there if they're going to do another cycle. After the pregnancy has been confirmed and it's a healthy pregnancy, you're released to your own OBGYN, and you just continue the rest of your pregnancy just like you would before. That wasn't exactly the site that I wanted to read you, but you can Google it again and find out more. But I found a site online that had like in-depth things like what you're going to have to do for like 3 to 4 weeks before the embryo transfer, all the injections and all this, and they'll have you taking like the prenatal vitamins and all that stuff. A lot of people request that you don't have intercourse for like the first 8 weeks. And that's pretty much it. Everything else is pretty much just like a regular pregnancy, but yeah. Anyways, I hope that helped, and if you guys have any questions, I'm obviously no means an expert, but I'm learning as I go, and I'm really hoping that here in the next couple weeks I'll tell you some really good news, and then I will vlog my way through the whole IVF pregnancy journey. So if you have any questions, let me know. If any of you think you could do that, I really, really recommend it. It's like a good feeling. I'm not even pregnant yet, and I have like a good feeling about giving something like that to somebody. So think about it, don't think about it, whatever, but thanks for watching. Bye.